Hey everyone, welcome back to Alison and Adreana. Today we're diving into something that honestly a lot of folks in Long Beach might think doesn't touch their lives, but it really does. I want to start with Marion. She's 101 years old, sharp as ever, and she's been living in Long Beach for decades. Marion's got this whole network, her church family, neighbors, her own kids, but her body just needs more help these days. And that's where in-home health aides come in. Or, well, where they're supposed to come in.
Yeah, and Marion's story is, it's so real. She was doing okay, living on her own, still gardening, even cooking for herself when she could get a ride to the store. But after a fall, her family decided she needed more help at home. So, they brought in Cece, a Filipina aide who's been in the U.S. for decades. Marion really likes her. But, Cece can't be there all the time, and that's where things get complicated.
Exactly. When Cece couldn't make it, the agency would send someone else, sometimes a Filipina, sometimes a Latina. And every time, Marion had to re-explain everything. And here's the thing. Marion's English is, well, it's the kind of English you get from someone over 80, you know? There's a wobble, sometimes it's halting, and not every aide could understand her, especially the younger Filipina aides who hadn't been in the States as long. Marion would have to get up out of her wheelchair just to show them where things were. That's how she ended up overusing her leg and getting an infection. It's not just inconvenient, it's dangerous.
And the infection, the wound care, the constant new faces, there's a real risk there. One aide didn't even understand how to unlock the wheelchair brake, so Marion got dragged across the carpet. And then there's the infection risk. Some aides didn't bring gloves, only Cece did. It's a lot for someone who's already vulnerable. And, Adreana, you mentioned before about your grandmother having trouble with language barriers in medical care, right?
Oh, absolutely. My grandmother, she was in and out of hospitals, and every time there was a new nurse or aide, she'd get so frustrated. She'd say, "They don't hear me, they don't get what I'm saying." And it's not just about language, it's about understanding the person. That's what Marion's going through too. It's not just a system problem, it's a human problem.
So, let's talk about who's actually doing this work. Because honestly, I didn't realize just how much the in-home healthcare industry depends on immigrants until I started reading up for this episode. Filipinas and Latinas are the backbone of this industry, especially here in California. Nationally, Filipinos make up about 10% of immigrant home health aides, and Mexicans are at 15.5%. But in California, it's even more pronounced. Over 40% of home health aides are foreign-born. That's huge.
Yeah, and it's not just numbers, it's about the lived experience. The Latina aides, a lot of them grew up right here in Southern California. They get the language, they get the culture, and Marion never had trouble communicating with them. But the Filipina aides, especially the ones who immigrated as adults, sometimes struggled with Marion's English. And that's not a knock on them, it's just a reality of how language and culture play out in care. When you're 101, you need someone who can understand you, not just physically, but emotionally too.
And when you add in the fear of deportation, it gets even more complicated. Some aides are afraid to come to work, even if they're here legally, because of ICE raids or just the general climate. Agencies are understaffed, and they can't guarantee the same person will show up or that the person will speak English well enough. It's a mess. What happens when the people who are supposed to be caring for our most vulnerable are too scared to show up?
That's the thing. The agency told Marion's family, "We can't assign anyone, we just send whoever's available." And that's because they're so short-staffed. And look, I'm not saying every aide is undocumented, but the numbers are there. Nationally, about 7% of home health aides are undocumented. But in California, it's probably higher. And when people are afraid, or they've been snatched up by ICE, or they're dealing with the fallout from someone else being taken, they just stop showing up. That's the reality. So, let's get into the bigger picture. When you have mass deportation policies, like what we've seen under Trump, it's not just about the people being deported, it's about the whole system. Agencies are left scrambling, seniors like Marion are left unsupported, and families are forced to pick up the slack. And it's not just Long Beach, it's happening all over. There was this quote from the CEO of Leading Age, Katie Smith Sloan, saying that care homes and agencies are losing workers, not just because of raids, but because people are scared. Even folks who are here legally are staying home, keeping their kids out of school just in case. That's how deep the fear goes.
And it's not just elder care. I used to help families with special needs kids find caregivers, and it was already hard. Now, with fewer workers, the costs go up, and families are left to do more themselves. It's exhausting. And if you can't afford to pay more, you're stuck. Some people have to quit their jobs or dip into their own savings just to take care of a parent or a child. It's a ripple effect, one policy change, and suddenly everyone's life is harder.
Exactly. And when this cost of care goes up, it doesn't just hit the families, it hits the whole economy. Insurance premiums rise, people end up in the ER because they can't afford in-home help, and other industries lose workers because folks are leaving for higher-paying care jobs. It's all connected. And maybe if more native-born people end up in these jobs, we'll finally have a real conversation about worker dignity and safety. But right now, the system is just not ready for this kind of shock.
And I think a lot of people don't realize how close to home this hits. You might think, oh, that's not my problem. But if you have aging parents, or you're planning for your own future, it absolutely is. We're all going to feel it, especially here in California, where the population is aging fast. It's not just a political issue, it's a personal one.
That's right. So, if you're walking around thinking these policies don't affect you, I'm here to tell you, they do. Marion's story is just one example, but there are thousands more. And until we start seeing the human faces behind these policies, nothing's going to change. Alison, thanks for talking through this with me today.
Thank you, Adriana, and thanks to everyone for listening. We'll be back soon with more stories and more conversations. Take care, Adriana.
You too, Alison. Bye, everyone.